You know, happy Friday to you.
Thank you. Happy Friday to you as well. We made it. We made it.
Yes, sir. My favorite time of the week.
That's right. So, for those who are watching, I'm here today with Melvin Battle, who is a school based mental health therapist with Thompson. And school-based mental health is a program that Thompson offers that I'm sure Melvin can speak to quite a little bit more than I can. Today, what we really wanted to talk about, though, was just the overall importance of mental health as it relates to all of us, but especially the youth, being that's who Thompson really serves. Um, Melvin, you probably know a lot more than I do, so I just want to probably, move forward with our very first question, if that's all right.
Sure.
So when it comes to mental health therapy, why is it so important, would you say, to overall wellness?
Well, mental health therapy is important because it's very important for us to be able to just recognize what our challenges are regarding our medical health, our physical health, and in our case, here at Thompson, our mental health. You know, your mental health is your psychological, emotional well-being. You know, and being aware of your mental health is important because it really helps shapes our thoughts, our emotions, and our actions. In day-to-day life activities. So, just mental health is very important.
I like that because when you mention like it shapes our day to day, it literally I totally agree with that. And I think a lot of people, we don't really think of like the connectedness part of it all, how like how you're thinking and where you're at here affects like what you do, how you respond, how you react, how others react to you, and those types of things. So I think it's important for those reasons. I'm glad that we're having this conversation. So for those, and there may be many out there who are not in a place of ideal mental health. We might want to see some improvement to our mental health. How can mental health be improved through a program that incorporates aspects of therapy? Like, how can therapy improve your mental health?
Oh man, I think that talking is healing. And just by talking with a person and allowing you to have an opportunity to be able to vent, I mean, it's a lifelong healing. But speaking with a professional individual, how to just process your feelings and your emotion and how to respond to life challenges, it can just be a blessing. So. Just a person's mental health can be improved through therapy just by having the ability to process their feelings, process their thoughts, having a individual that's neutral that can be able to provide support by using evidence-based practices and professional practices to help support, just the client's improvement.
Okay. So you're dropping in the sauce in here. I really like it. I heard evidence-based and I'm like, okay, okay, okay. Because that's very important when it comes to, what Thompson does and overall, therapeutic practices. Could you just give me a bit of what evidence-based really means? I know, but I want to hear from you.
Okay, no problem at all. Because see, data and statistics and research, it really drives policies and procedures that we live here in, I guess society in the world. So if you take the same concept, it's the same thing in regards to mental health. There's evidence-based modality that has been proven to work with the population that we serve to help support. For an example, I am a trauma-focused cognitive behavior therapist, and that involves just being able to help support clients who have experienced or witnessed traumatic experiences. In addition to that, Thompson offer a plethora of evidence-based modalities and services like family-centered treatment, intensive in-home services, and also there's a TFCBT involved. So there is a plethora of evidence-based services that Thompson's offer. But evidence-based basically means that these approaches, services, interventions have been proven to work with the population that we're serving. But at times, if I can be quite transparent, it's very difficult to be able to apply some evidence both evidence-based modalities in school, such as trauma or TFCBT, because at times, it's just hard to address and process trauma in the school setting, but it's imperative to be able to kind of teach healthy coping skills and explore ways for our students and our clients to manage their trauma symptoms that may be affecting them in their academic setting.
Okay, now Melvin, this is a great stopping point, pausing point, because you've said so much. I took some notes too. You said a lot of things, because you're there and you're dropping it. So let's break this up for those who may be watching.
Okay.
First thing you mentioned was the evidence-based practice. It's a pleasure to talk to you. You mentioned the evidence-based practices, and basically what that means is it's like a proven model. It's based off of data, statistics. It's like as professional as it can be. That's really what it means, and that's a way to inform, our program and our programs really. So for those who may be coming and like, hey, how legit is this? How professional is this? How well put together is this? How much data is going into this? That's a method. That's a indicator that, hey, we have that. Now there's also the piece of it, like you mentioned, there's still some challenges because how sometimes it can be difficult to use the evidence based even with these types of things because that's the nature of this, right? So when you mention there's other parts of it, like the coping, the being able to process feelings, being able to process emotions, those are tactics and strategies that you can employ that these programs offer as well, right? And
Yes,
there's
sir.
like even the opportunity just to vent. Like I took that down as a note because for those who may be struggling with mental health, especially the youth, they may not have a place that they feel is like comfortable for them to vent. So to be able to go to a program, to have a program that supports that allows them opportunity to cope with their feelings, to cope with what they're maybe seeing and hearing, to cope with past trauma. That was the other thing that I wanted to talk to you about was like, because how does past trauma affect a person's mental health? Like I've seen this, but like for those who are just kind of new to thinking about mental health, like what does that really mean? Like what are they possibly could they experience?
Oh, wow. I think depending on the individual, their trauma symptoms can manifest differently. It can manifest within their moods, in their relationship with others, their anxiety, maybe having flashbacks and triggers, depression. So depending on the individual and that traumatic experience, it can manifest differently. So trauma can cause just an emotional effect on individuals, and at times it can be unwarranted. For an example, the students at the school, it can be someone, it can be a student that maybe have went through an experience, some type of trauma, and maybe they might have been triggered by the teacher maybe yelling at them or speaking down to them. They can be triggered by seeing someone else be assaulted, whether it be sexually or physically, and that can manifest into just their behaviors, their mood, how they treat people, and then also just depression. So just really trauma can manifest in different ways and just throughout our day-to-day life activities.
Yeah, and I think it's probably good to be aware that trauma can manifest itself in a wide range of ways because that can probably explain sometimes what we maybe see, what we witness, and we may see the manifestation of trauma without being able to really identify that this may be coming from a place of trauma. So we see some behavior that, has been labeled in the past as insert adjective here that we probably wouldn't even want to say, or like why is this person acting like this, or whatever. But like again, this is coming from a place of trauma, and I guess it's the purpose of our programs is to be trauma informed, which is another thing that that Thompson really embodies, is just like understanding where this may be coming from and then offering the support, knowing the landscape of that. one of the things that I wanted to ask you about was maybe a first timer, maybe somebody who's never really like experienced support from a mental health standpoint. Like, what kind of support would programs like the one that you work in, like what kind of support does that offer to first timers?
Well, first timers, they are a blessing. I think that it's an opportunity to provide just psychoeducation on mental health and in general, meaning the causes of mental health, the effects of mental health, and managing mental health. And one of the tools that I use is the cognitive triangle, which is a popular tool that therapists use to be able to kind of help provide psychoeducation on how your behaviors may affect your emotions, and your emotion may affect just how you respond to things, and also your thoughts. So your thoughts, your behaviors, and also your emotions, and how they are all intertwined with each other, and managing them will be helpful and conducive to be able to manage your overall mental health, because it's like a ripple effect. They're going to all play off of each other.
Okay, and that's great. So it sounds like you have a pretty good approach that's based around tools to kind of know how to optimize things for even for for a first time or somebody who's never really had. Because I think that's the main thing. Somebody may be watching. I don't want anybody to feel like oh this we're using big words and like we don't know. Like I think that Thompson and I think Melvin, you're the perfect person to talk about this, man. It's just obvious that you have a good understanding of mental health and support for mental health and the tools around that. Maybe you could talk to me a little bit more explicitly about the program that you're in, school-based mental health. Like, how does that work and how long does it go? Does it go to full semester? Like, talk to me about school-based mental health.
Um, well, typically the referral process is it's really simple. The counselors, I may identify an individual or a student that they may feel might be demonstrating mental health issues, such as just behavior concerns, maybe moods. In addition to that, just their overall academic performance. So a referral will be submitted to, I think, their main office, and Thompson. We will receive the referral in the database that we use, and we reach out to the family to get consent for services. Once the consent for services have been signed, I'm ready to go in. I'm ready to call them in to complete a comprehensive clinical assessment, in which I gather some background in regards to their upbringing, mental health, previous treatment, and then also being able to identify the problem they feel that brings them to therapy and their goals.
Mhm.
There at times, a lot of students, they may not be fully aware of the reasons for referral, but most likely before we conclude the clinical assessment, I normally revisit what brings you here to therapy, and they're able to, you know, um, communicate or maybe express, what are some of the challenges that they have.
Okay, okay. No, that's very helpful to understand just kind of like to lay it out like that, how that program works. It seems like it would be very effective. And I think based off of what I've seen that we have demonstrated that level of success in addressing some of the challenges. Um, Thank you very much for sharing that insight. Who could somebody maybe who's watching, who could they reach out to? Would they be able to reach out to you or maybe somebody else if they had more questions about school-based mental health or they wanted to go into the to learn more about the program? Like who could they talk to?
Absolutely. They can speak with their school counselors. And I think there's a representative at every school that coordinates. I can't think of her name right now. Down at the district office, Miss Carrie Sargent.
Okay.
They communicate with Miss Carrie Sargent, and Miss Sargent will meet with one of our individuals here within Thompson, whether it be Mary, Catherine Elkins, or they can always reach me directly, and I will begin to initiate the referral from the Thompson's process.
hmm
So
hmm That's perfect. That's literally perfect. Thank you so much for sharing that. Melvin, it was an absolute pleasure to talk to you. You've shared a wealth of information. Thank you so much once again. I wish you a very nice day. Have a great day, and we'll talk soon, okay?
Okay, all right. Thank you so much. Thanks for having me.
You're welcome. Take care. Bye
Okay,
now.
you too.